We may have heard about the difference between linear and logarithmic scales. See Chapter 13. We certainly heard all about the percentages of vaccinated, unvaccinated, and hospitalized people, the average age of people who died from the disease, compared with the general longevity of the overall population, and the pace at which the pandemic was spreading locally and worldwide. We were fed the number of fatalities per million people, the rate of bed occupancy in COVID wings, and the number of people terrified they might get sick. We considered herd immunity and reflected upon the correlation, another statistics buzzword that we'll discuss later, between socioeconomic status and the chances of contracting the virus. In short, all those analyses could be squeezed into a decent Statistics 101 academic course, coupled with a brief workshop in probability. Statistics like these are also very important to every worthy government. Using them, governments can make calculated decisions about public health, security, transportation, the environment, crime, care of elderly people, education, and many other important issues. Statistical models play a crucial role in almost every prediction, including those about earthquakes, insurance rates, political shifts, and so forth. Statistics help when managing crises and planning ahead for natural disasters or collateral war damage. Clinicians use statistics to examine patients' reactions to various treatments. Medical experts use them to draw conclusions from gathered data and to make educated, data-based decisions. Statistics show whether a given drug helps with curing a given disease and provide guidance, for example, whether doctors should recommend that men with prostate cancer undergo radical prostatectomy or just carefully monitor their status. Familiarization with the terminology and ideas of statistics and probability could prevent numerous mistakes and biases in medical research. Dangerous statistics. I once discussed the use of statistics in medicine with my good and wise friend, Professor Igor Elman of Harvard University Medical School. Giving me an example of irresponsible studies, Igor showed me a short letter to the editor, authored by Jane Porter and Herschel Jick of Boston University, which the prestigious New England Journal of Medicine published in 1980. It claimed that among nearly 12,000 patients given opioids in hospital, quote, there were only 4 cases of reasonably well-documented addiction in patients who had no history of addiction. That letter and the study it discussed has since been cited extensively and eventually heralded a lenient approach toward opioids and the liberal prescription of such drugs when treating pain on the assumption that addiction was unlikely. It made a great impression on many physicians, who started prescribing them for domestic consumption lightly and without restriction, all the while ignoring both the study's methodological flaws, though it was conducted on an impressive sample of 39,946 patients, and the fact that its conclusion was valid only for patients who were treated with low opioid dosages and closely monitored by and in hospitals. Today, some 40 years after that letter was published, Igor told me, we are struggling with a terrible health issue where more than 2 million individuals are addicted to opioids in the USA alone, many of whom are susceptible to various diseases and high mortality rates. We have some 130 daily cases of death by overdose, which is close to 50,000 deaths annually. Some experts think the numbers are way higher. Indeed, speaking on U.S. National Public Radio in 2017, Herschel Jick said that if he'd known in 1980 what he knew today, he would not have published that letter. Statistics hold power, especially when important decision-makers are relying on them to guide their decisions. As such, they can be dangerous when taken out of context. Immersed in statistics. The truth is that most researchers across every field of science